Living with kidney disease means that there will be changes to your life. Using this video, we want to help you to learn how you can live with kidney disease and the treatment options that are right for you.
My name is Mona Hardy. I'm from Binjgowabik, Tawagan, in Shinabek. It's a little reserve about a 2-hour drive from here, another way. Well, I started off when I was in Montreal. I was very tired, very fatigued. Working mental health, I thought I was suffering from a depression until I almost totally collapsed, and I started dialysis right then and there. Like there was no in-between, no time to decide, I honestly thought I was suffering from a depression. It's so easily, because, I worked with the clinically depressed, and this is how they were describing how they felt. They didn't have no ambition, didn't want to walk, didn't want to move, didn't want to eat. And then I'm getting fatter and fatter, and my Lord, and I'm not eating, why am I getting fat? I was constantly thirsty, and I'm drinking. My legs started swelling. I went to the hospital, an emergency, and I collapsed in the doorway at the hospital. Everything was shut down, and I was hospitalized for a while and started dialysis. Yeah, my mother was on renal and home hemo for 18 years. I had a lot of cousins. My mother's sisters, Catherine and Jane, they died from renal failure.
Hemodialysis is a treatment for kidney disease. Hemodialysis means cleaning the blood, and that is what this treatment does. During hemodialysis, your blood travels from your blood vessel through a tube to a filter on the hemodialysis machine. It is then cleaned and returned back to you through another tube. If you choose hemodialysis as your treatment option, you will go to the hemodialysis unit at the hospital, where nurses will connect you to the dialysis machine to clean your blood. Hemodialysis usually occurs 3 times every week and takes about 4 hours each time.
I come 3 times a week, and it's 4 hours each session. There are options in dialysis. You can do home hemo, you can do a peritoneal, but I choose hemodialysis because it's less time consuming. So this is the best option for me. I'm a social. I got things to do, places to be, people to bug. A downside to dialysis, you have limitations. You can't pick up and go when you want, like I usually did, because I used to travel a lot. But now, you have to make arrangements, you have to, ahead of time, to see if certain hospitals won't take transient patients. Dialysis isn't all my life, it's a part of my life. I have more life than dialysis.
For hemodialysis, there needs to be a way to move your blood from your body to the hemodialysis machine. This is done by having a procedure to create access to a blood vessel. This new site will allow your blood to travel from you to the filter on the machine and then back to you once it has been cleaned. People can choose to have hemodialysis in a center like a hospital, or they can learn to do this treatment at home. Living with kidney disease will have many effects on your life, but you can learn to manage it and continue to live a good life.
You know, I find if you had a life before dialysis, if you didn't have a life before dialysis, you're sure not going to develop one after, because it's very time consuming. So, but you're going to have to keep yourself busy, because it's not just dialysis, that's not your life. There's other things in life. If you can't find a job, volunteer, do something. You'll feel better about yourself, because most people just sit and veg. And I've met a lot of people that are on dialysis that say, I should have. Well, why can't you now? It's simple. If you really want to do something, you do it. There's no stopping.
As part of treatment for kidney disease, your kidney doctor will prescribe many medications that you will take throughout the day. It is important for your health that you do your best to take them and follow their instructions. Another essential part of managing your health when you are living with kidney disease is good nutrition. You will work with a dietitian who will teach you about the special diet that you will require to manage your health. Kidney disease affects the physical body, but it can also affect other parts of your life as well.
Well, I guess you go through the 7 stages of dying. You know, that when somebody dies, that acceptance, and finally you come to terms. And sometimes people come to terms too late. You know, choose a treatment that's good for you. We really have to take care of ourselves. We only have ourselves. And we're the only one that can take care of ourselves.